Hello everyone. So we are back with this series of lectures of INICET PYT discussion, and this is the 8th video. In this we'll discuss two questions. This is the first question which came in INICET 2022 exam. The question read as, which of the following drug is not used for the management of hyperkalemia? Option 1, 10% calcium gluconate. Second, salbutamol nebulization. Third, insulin dextrose. Fourth, injection max sulfate. So as we know, 10% calcium gluconate is used, salbutamol is used, insulin dextrose is used, magnesium sulfate is not used. It is sometimes given for the treatment of hyperkalemia. Let us now discuss about the treatment of hyperkalemia. First of all, what is hyperkalemia? Hyperkalemia is potassium levels more than 5.5. Okay, and it has to be treated whether there are ECG changes or not. Potassium level of more than 5.5 has to be treated. Okay, now what are the ECG changes in hyperkalemia? We have already discussed, so we'll not discuss it here. Now, causes of hyperkalemia are multiple, but most important cause in our practice is drugs, other than the renal failure. These two are most important causes, and we have to rule them out whenever a patient with hyperkalemia came to us. So you have to tell me in the comment section that what three drugs are there which causes hyperkalemia. Multiple drugs causes, but you have to tell me three common drugs that causes hyperkalemia. Now treatment is, one is 10% calcium gluconate. What it does is it stabilizes the myocardium. So the effect of potassium on myocardium decreases. So it decreases the chances of cardiac arrest and cardiac arrhythmias. Okay. So definitely we have to start the treatment with 10% calcium gluconate. Then we can give insulin dextrose drip. So what insulin does is it pushes the potassium into the cells. So it decreases potassium level in the serum. Why dextrose? Because insulin itself can cause hypoglycemia. So we have to give dextrose with it. Okay. Then third thing that we give is salbutamol nebulization. Why? Because salbutamol is a beta 2 agonist and it also pushes the potassium into the cells. Okay. So we have to start the management with these three drugs. Also, we can give diuretics, but they take some time to act. Okay. So further management, immediate management with these three drugs, then we can give diuretics, loop diuretics, and thiazide diuretics. Okay. Okay. Then we can give potassium binders and exchange resins. They also have a slow action, so definitely they are not the immediate line of management. Then if the hyperkalemia is resistant to all this management, then we have to go for dialysis. Okay. So the final management is dialysis, dialysis, dialysis. Okay. Now magnesium sulfate is generally given in refractory hypokalemia. Okay. So answer is magnesium sulfate. This is the second question. This question came in INICET 2022. The question read as, which of the following is true regarding the placement of ECG leads? Okay. So first option is the earth to all leads is in the right leg. नहीं पता हमें. Okay. So mostly क्या है कि ये तो एक ऐसा फिजिक्स का टॉपिक है that we don't know कि हम अर्थ कहाँ पे अटैच है, बट और ऑप्शंस पढ़ के देखते हैं. Lead 1 positive pole to the right, negative pole to the left. Lead 3 positive pole on left, negative pole on right. Lead 2 positive pole on right and negative pole towards right, left. तो पहले डिस्कस करते हैं. ECG में we have limb leads, in frontal plane and chest leads in horizontal plane. So अभी यहाँ पे lead 1, 2, 3 का discussion हुआ which are limb leads. Okay. So let us discuss about the limb leads. In limb leads we have this lead 1 with a negative electrode in right upper limb and a positive electrode in left upper limb. Okay. So this is the right side of the body. This is the left side of the wall. Okay. Now we have lead 2 like this with a negative electrode again in right upper limb and a positive electrode in left lower limb. And then we have this lead 3 with a negative electrode in left upper limb and a positive electrode in left lower limb. Okay. So in limb leads का main purpose is कि positive electrode हमेशा heart की axis में. So heart की axis क्या है? Like this. This is the axis of the heart. It is somewhat tilted towards the left and downwards. Okay. So हमेशा downward positive होगा, है ना? And left one is positive. Okay. So the option is lead one, the positive pole to the right, negative pole to the left. So this is wrong. Okay. Because in lead one we have negative pole to the right and a positive pole to the left. So then lead 2, 2, 3. Third option, positive pole on left, negative pole on right of lead 3. So this is lead 3 and the negative pole is on the left and the positive pole is also on the left side. Okay. So this is wrong. Lead 2, positive pole on right and negative pole towards left. So this is lead 2, negative pole on right and positive pole towards left. Okay. So all these three are wrong. So definitely this one is left. So this is the correct answer. ऑल्सो अगर आपने कभी ईसीजी लगते हुए देखा होगा तो चारों लिम्ब में एक एक इलेक्ट्रोड लगता है बट अकॉर्डिंग टू दिस वन इलेक्ट्रोड इज इन राइट अपर लिम्ब वन इज इन लेफ्ट अपर लिम्ब वन इज इन लेफ्ट लोअर लिम्ब सो राइट लोअर लिम्ब में डेफिनेटली जो इलेक्ट्रोड लग रहा है दैट वन इज द अर्थ इलेक्ट्रोड सो द अर्थ टू ऑल लीड्स इज इन द राइट लेग दिस इज द राइट आंसर इन ऑल द बेस्ट गाइस